So, our project is on intrathecal drug delivery devices for treating patients with chronic pain for whom more conservative therapies such as oral and intravenous medication have failed.
In 2019, the CDC reported that 20.4% of adults suffer from some form of chronic pain, and 7.4% experience what's called high impact chronic pain. The graph that you see shows the distribution of US adults that suffer from chronic pain based on gender. As you can see, women have a higher tendency to suffer from chronic pain. The economic costs of chronic pain are estimated to be upwards of $560 billion when accounting for both medical costs and missed work days, and upwards of 30% of terminally ill patients, including those that suffer from some form of terminal cancer, report that they have not found adequate pain relief.
So, our plan for treating patients with chronic pain for who oral and intravenous therapy has failed is an intrathecal pain pump. There are already a few of these on the market, such as the Medtronic one in the corner. It's a small disc around 3 inches that's implanted in the abdomen with a catheter attached. This catheter goes into the subarachnoid or intrathecal space of the patient to directly deliver pain medication to the nerves at significantly lower doses and with limiting systemic side effects. There are a couple issues with existing devices on the market, such as migration disconnection, in which we hope to improve the catheter connection, inflammatory granuloma forming at the tip due to high morphine doses. We hope to add a cap to lower the concentration of morphine at one point and more to stretch it out to limit that change in cerebral spinal fluid and device pocket inflammation. And we hope to add a coating to prevent protein to cell interactions and the inflammatory response. We have also found that patients have spinal cord stimulators implanted that delivers low electric currents to the spine in order to limit pain. We've decided to combine the two into one device to significantly lower patients' pain. In a couple of small studies, it has been found that using both of these devices together lowered a patient's pain overall, and we are hoping to combine them into one device in one surgery.
When looking at the benefits of intrathecal drug delivery versus oral and transdermal opioid use, we see that a large majority of patients either eliminated or at least limited their opioid use for pain management. This reduces the overall spending on pain management drugs. Obviously, the therapy is going to have a cost in itself, but when we look at the overall amount of spending, it is less than what a patient will be spending with these opioid pain management drugs. It also decreases the long-term dependence of opioid use, which is going to lead to a better quality of life for the patient. When we look more into the quality of life, patients also feel a decrease in pain levels. They have better physical conditions, they have the ability to move better, and they're able to do more physical activities. And so all these things in combination really give the patient a better quality of life. When we look at intrathecal drug delivery, and spinal stimulation together, a large majority of the patients said they enjoyed the treatment and they would recommend it to others. And 100% of the patients in a specific study noted that they did have a better quality of life and they actually had continued use of the treatment upon a follow-up check-in.
As Kevin said, chronic pain in the US is a $600 billion industry. This, of course, comes the high individual cost of each patient. It has been found that intrathecal pain pumps pay for themselves in 2 to 3 years, despite the high initial costs for surgeries and the device, due to a decrease in doctor's visits and medication doses needed. It even results in savings in patients who have the device long term. It has also been found that spinal cord stimulation therapy results in a significant amount of patients either returning to work or finding new work. We have thought that since combining our two devices into one, they would cost the same as a normal intrathecal pain pump with the added benefit of putting patients back to work, resulting in a patient having a better financial situation overall.
When we look at other options, we see that patients who suffer from severe or chronic pain typically use oral or intravenous pain medications. These don't always work or give them the effect that they had hoped, or they have negative unwanted side effects. Current intrathecal pain pumps on the market right now also have a numerous amounts of issues. These include inflammatory granulomas at the catheter tip, the catheter becoming disconnected, leading to spinal cord leaks, and pump site inflammation. But there's currently no other devices on the market that provide both this intrathecal drug delivery system and spinal cord stimulation.